Welcome to Lyme and Beyond with Tanya. I'm so glad you guys are tuning into this episode. Whatever it is that you're dealing with today specifically or going through at the moment, I just hope that your takeaway from this episode is going to give you what you need. Is it hope, inspiration, validation, some tips on how to treat this or detox more affordable? Whatever it is that you need today, I hope that that's what you get from this episode. And if you want to continue to help me share my voice and our voice in the community, please go into the About of this podcast, scroll to the bottom, click on that donation link. Welcome to Lyme and Beyond with Tanya. And my guest today is joining us all the way from New York, Dr. Daniel Cameron. He is part of iLads. He's the author of An Expert's Guide on Navigating Lyme Disease. From what I've been reading about him, he sounds just fascinating. I'm super excited to kind of dive into, first of all, what even got him into Lyme disease, and then just all the different ways that he kind of goes through it and how he treats his treatment approach, maybe a little bit on, flaws in testing, and then maybe a little bit about the emotional side of Lyme and the toll that it takes on us that are battling it. So I'm excited to dive into all the stuff. And thank you so much, Dr. Cameron, for taking the time to join me and just share with all the listeners all your great knowledge. I appreciate you. Welcome to the show.
Thank you for the introduction, Tanya. So let me start with what you just first said, which is, where did I start from? I started from a farm in Minnesota.
Okay.
My dad said, well, you don't want to be a farmer, you got to do something else, because he was an unhappy farmer. So it's then I went to medical school and thought geriatrics would be my calling. So I became a dementia specialist and Alzheimer's doctor. And when I moved to the community in New York and set up an office, there were so many Lyme patients that had some of the same issues that the elderly had. The psych, the social, the chronicity, the misunderstood, everything you can possibly think of that the elderly were facing. You could be 15 and have the same problems.
Something doesn't add up, right?
What's that?
Something doesn't add up with that, right?
That's it. So that it's not fair at that age to have that many troubles. And it turned out that over time, it's been 37 years later, it's just as challenging now as it was back then to take each and every patient I have and take them from where they're at to how do you get your health back?
Wow. Okay. So yeah, a lot of us, I mean, I know for me personally, when I was on my journey, it was like I had Alzheimer's. I got to where I would lose my short-term memory and then my long-term memory. And it was like I lived in this world of disassociation. I didn't even know if it was really happening or if I was dreaming. And so when you're young, I was in my early 30s, I thought, this isn't normal. What is wrong? I thought I was a healthy person, and then when you go down the rabbit holes of these doctors telling you that it's all in your head, quit working so much, quit stressing so much, maybe your memory will come back. And so it's interesting that you mentioned that, because I think so many of us feel like we have dementia or Alzheimer's, and a lot of times, it's the Lyme that's running rampant in our body.
Well, I think that I was fascinated because I was a dementia specialist, but they don't quite make the criteria. But at the beginning, it can be somewhat close if you don't look carefully. That concentration, it's usually processing issues, the word finding problems, and the brain is just not working. That's why the brain fog is actually fairly descriptive of where it comes and goes rather quickly. And so they're not really turning into dementia over time. I thought 37 years later, I'd get a bunch of dementia patients, but no, it's not happening. But it certainly frightens them. Or if your kid is in high school, to get ready for college and your brain isn't working, it can really mess up someone's social life as well as their education.
Yeah. Well, I'm thankful to your father for not allowing you to be a farmer and that you've graduated up into the Lyme world, because we need doctors that can validate us and want to work with us and take us as an individual person, an individual patient, because oftentimes we just get thrown into this works for everyone, and our bodies are different.
Well, I've found over time, you get better at understanding what's going on. And the best description that I have is that the immune system is busy fighting Lyme, and the whole fight or flight, the adrenaline system, the cytokines, the neurotransmitters are all turned to high trying to solve the problem. So that's why they almost always have kind of tired, wired fatigue, can't sleep, they can't think as cleanly, or they're so overactive, they do what you're talking about, is that you almost feel like out of body or out of something unreal. They usually have the autonomic nervous system problem where their
Yes.
whole adrenaline is off. They might, if they're young, they have POTS, but
Hmm.
if they get older, that autonomic gives kind of sensory overload, gives stomach problems related, not related to the stomach itself, but it just doesn't function right. They have every mood issue you can think of, but it's not continuous. It tends to be a tsunami type wave. But even though somebody has one or two they notice, it seems like with Lyme, if you ask further questions, it won't take you very long to realize that quite a few problems are all occurring at the same time. They just hadn't realized that they're all connected.
Right. And that's sometimes hard to put the pieces together.
Usually there's up and down, back and forth. And so by the time 6 months pass or 3 years is they lose track of what normal is. In fact, the brain
Right.
fog make it difficult to even clearly identify the problem. So usually a friend is the one who says, by the way, you're not where you need to be. You shouldn't be 29 feeling that way.
Yeah.
And somebody else says it, then maybe it takes three more people. And finally, after 4 or 5 people come to the same conclusion, they'll finally seek out an evaluation. Although sometimes, though, that they'll run into a doctor who says, I don't know what it is, but all I know is it's not Lyme. And if somebody hears that, they'll say, well, I'm used to it. The doctor knows best. And
Hmm.
so, but their family's saying the opposite. So months can pass before someone actually decides to get evaluated for Lyme disease.
Right. And that's a really good point to bring up, because in my mind, I've always thought most of us turn into chronic Lyme disease because we don't have accurate testing, right? Like, we have a lot of flaws in our testing. But now hearing you say it from a different perspective, that makes sense, right? Because a lot of times we don't, especially if it kind of starts in our brain, we don't recognize those things, and we have to hear them from our loved ones before we think, okay, maybe something is really wrong with me. And now you've gone 6 months, a year without the proper treatment from an initial Lyme disease.
Well, Lyme disease gets kind of a bad rap sometimes because people are so sick, having so many problems that they forget that a lot of people get better. It's certainly easy to find bad outcomes. They're on the internet all the time. I have people with bad outcomes, but there's so many people out there where if they revisit Lyme or get treated for a co-infection or babesia who do well. So I often have people graduating all the time. If I, if I keep my office open to a broad range of Lyme disease patients, then I do quite well. And that's why I often share that joy of taking somebody from a near impossible situation to back on track. You know, it's always very rewarding as a doctor when someone goes from dropping out of high school and to getting back in school, finishing school, and getting on and getting married, having kids. And the only reason I know that they're still well is that I run into their mom, and their mom says, "Well, they got their life back." And so it's quite rewarding to be in practice 37 years and still get these people at it well. And that's why I've been often talking about, you know, hope and perseverance, because even at your worst, I could take somebody and start working with what they have, and how do you rebuild it? I tend to take an antibiotic approach rather than more of a fatalistic, mold and alternative medicine type thing. I think that revisiting an antibiotic helps. What I do find is that a lot of times the highest dose, the longer dose, the combination sometimes is so hard to take that people give up on the antibiotics and they don't go ahead with it. So sometimes revisiting it and tailoring the treatment to what they can tolerate can get breakthroughs that they didn't anticipate. Or babesia, which is overlooked, it's often discarded, is a problem, or they'll use too high a dose of the babesia treatment. And so if I can tailor something to a much lower dose to start with, that I can pull a lot of people out. And that's why I like to share some of the secrets of, I call it common sense Lyme, instead of always the what are the extremes, how bad can it get, is what would be a reasonable thing for somebody on a reasonable budget who doesn't have all the resources, all the time, and all the energy to do everything.
Mm, I love that. So I'm going to back up a couple things ago that you said. So the hope, I could just imagine how gratifying and rewarding it is to go through what you just said, right? You see somebody come in, they've given up, right? Their parents are on, my child's on death's door. What am I going to do? And then you restore them. And then you see them within the community, or, they write reviews about you. And that is truly the reason I do this podcast, is because we oftentimes lose that hope. If you don't have hope, what do you have? Right. And so I bring this platform to be able to share hope and inspiration, because we can get well, right? It may not be an easy journey, but we can. So I appreciate you so much for that. And then I love that you go with the approach of, is the antibiotic protocol too much, right? Because oftentimes people think, when we're doing whatever protocol we're on, that you have to herx so bad that you're just so miserable, right? You can't function. And I appreciate hearing you say that. No, is what I'm gathering you're saying is no, we can modify your particular dosage so that you are not extremely debilitated from a herx going through this journey. We definitely have to, it's not an easy journey, right? We have to go through the hard times to get there, but we need to take a lot more steps forwards than we do backwards. And
Yeah, I want to give an
sometimes I feel,
example of that.
yes,
Um,
please do.
that is that first of all, I don't like to trigger or introduce a Herxheimer just to thinking I'm going to get somewhere. My job is to try to crank it down and turn it down a notch. So on the Babesia one is probably the best example, because people take Malarone instead of Mepron, which is 750 milligrams. Malarone is a pill that's 250 milligrams, but they make a pediatric one, which is 62.5. There's a big leap between 750 and a pediatric dose of 62.5. So
Just a little bit.
if they're having an autonomic issue, when the stomach is a problem, or they're having troubles with herx and the immune system is too busy, their fight or flight's too high, is that 62.5 is what I start with. Instead of twice a day, I sometimes do once a day. Or doxycycline, instead of 100 milligrams, I'll do 50. But in any case, I got to find a way that I can introduce medicines at a level that they can take. I certainly have people who can take, massive doses, can tolerate things and tolerate three things at once. And, they certainly exist, but if they're pretty sick, I find that I can introduce a lower, more methodical, tailor-made approach. And so I'm always talking about how to do it. The other thing I often do is that instead of an endless amount of discussion of what endless amount of tests to do and what endless amount of alternative medicines to take and what dose and where to get it, I found that counseling at the time of the antibiotic helps get them through that most difficult time, is that even if somebody has no hope, they tend to have some hope still, if you can work with it. They hope to get from the bed to the couch, or from the couch to the kitchen, or maybe even do something in the kitchen. And also you'd be surprised how many kids keep their education alive. So it's some can't, but others, I don't know how they can do it, but they keep their education going despite the problems. The parents work hard because when they get better, it's nice if they have an education in place. So I'm trying to counsel them to, how do you keep your goals alive despite sinking so low, so you can get build that hope, that perseverance that they have, that seems so beat up.
Yeah, and that's so important. It's, slow and steady can win the race, right? We're all different. We need to find that pace that works for us. And I
Mhm.
believe that Lyme is like peeling an onion in layers. And I think one of those layers is the mental health aspect of it. So I love that you recommend counseling to your patients, because it really is hard. It's a tough journey we go through. And I want to say it, I don't want to say that it's harder for one than the other, but it's got to be really tough for these kids in their teens, right? Like they're just kind of getting their life going. They're in a very vulnerable age, and then it's kind of life is ripped from them. And so, like you said, we don't want to be at the end of their high school years and they had to quit in junior high. You know what I mean? That's just more traumatic events to add to their lifetime. So I love that approach.
Let me clarify counseling just a little, is that
Oh,
I'm not talking about removing them and saying, go to a therapist, go to a psychiatrist. I'm just talking about old-fashioned medicine, where you spend some time engaging them, bringing them on to where they're at, capturing it, reinforcing what kind of treatment they should have, how they're going to comply with it, set the goals, work on those goals, and sometimes all they get is windows. First thing to do is tolerate the drug. First month, get some windows where they'll see something, but it's pretty hard to want to get it all in that first month if you're particularly sick. So I think that one-on-one, old-fashioned garden variety medicine of taking on a patient for and engaging them works well for me.
okay. Well, thank you for clarifying, because I was definitely in another zone there, because I thought you were talking about sending them out. But we don't hear this ever, right? With most doctors, we get the 10-minute office appointment, right? Do this, do that. They don't want to engage on a human level, right, with us and look more at us as maybe a number, so to say.
Well, I think that, I don't do alternative medicine. I leave that up to the specialists that do it. But alternative medicine is fairly time consuming, and
Yeah.
the tests that go with it is time consuming. So the time that a doctor might spend in engaging the patient sometimes is lost in what supplement to take, where should you get it, and what dose to take it, and how many side effects there are, and endless amount of tests. And so sometimes that doctors who are well-meaning, that know Lyme really well, I just wanted to remind them always this, that the piece they're missing sometimes is, how do you take on the patient where they're at, and not necessarily up front at the desk where they have to figure out what supplement to take. Is it, where are you, how are you doing, and how can we negotiate one-on-one as a doctor-patient a plan, despite having been beat up so much.
Mm. Where have you been? Where have you been hiding, Dr. Cameron?
Well,
I love
that's
that.
why today I'm on a podcasting, because you can't see me in your podcast. No, I'm around. And it's surprising how after 37 years, I'm still around. I've been, I'm more longevity in my genes. So, but
Yeah,
usually it's a
well,
pretty relaxing life. I'll just take one-on-one and take them on and try to figure out a creative way to get something going, rather than trying to just take bragging rights of how high a dose and how much you could do and how many tests you could order. And
Not a competition, right?
which is great for a PowerPoint presentation, but it's often difficult to take the person and introduce them to all the stuff that's out there. It's all well-meaning, all that the research and everything else is done, and trying to understand what Lyme is great. It's just that what I call common sense Lyme, which is what my focus is when it comes to that patient that's there, is that all that stuff that I'm learning and reading doesn't necessarily mean that that's going to get the patient to um, well, from my perspective.
Right. No, and that makes sense. And you mentioned a couple of times earlier, trying to get the patient just out of bed and then to the couch and then from the couch to the bathroom. And that's, something I always want the listeners to kind of hone in on is every little win that you have along this journey, right? You got to celebrate them. I think celebrating those small wins, big wins are so important because it is hard to stay focused and go through this treating journey. It can be difficult on our body, our minds, and we one way I think we can continue to keep that hope is to reassure ourselves, whether you're journaling or health tracking or whatever it is that you're doing, so that you can look back and say, you know what, I'm not where I need to be, but boy, this is better and this is better, right? It kind of gives us that motivation.
Well, I can say that even though I'm talking about the ones that make that marathon move from the bed to the couch to the kitchen there's an awful lot of people that are working in my practice. It's tough.
Yeah,
They don't have any energy. They have nothing left in their life past the job. In fact, the only time they feel good is that they're out of bed moving.
right.
By two, they might be sinking. So and then even moms, can't really stop being a mom. And so there's an awful lot of brave moms and dads who are sick where they can look better than they really feel. Their quality of life is pretty crappy. So just because that some kids are in trouble, some not all kids are in trouble. But there's a whole wide range of where do you meet them? How do you get them so they can get healthy, not just at the job, but all day, and not just when they're walking, but when they're sedentary. How can you go into the evening or weekend feeling relatively good? And how do you make that transition? And plus there's a lot of negativity out there. They're getting beat up all the time by the others who say, "But you look good, you're working. How can you be sick?" And so that how do you deal with a major significant illness and get no respect?
Yeah, that's a really good point. I went through my journey, I don't want to say alone because I had amazing friends and family support, but I lived alone, right? I'm sole provider for my home, no children, and I had to work and I had to fumble through that. I could not even imagine what those who have children or, their children they're treating as well. Like it's hard enough just to handle it on your own, let alone having to caretake for somebody else as well. And then the whole aspect of, well, you look fine and you look good. Yeah, we probably want to hear that, but we really don't. You know what I mean? I was to the point where when I would go into the grocery store, I had to eventually get into one of those little scooters to make my way through the grocery store because I couldn't send anybody to go for me because I had to read every ingredient label, right? Because my diet was so specific. I had to get healthy foods in my body. And I was just devastated being in my 30s, riding around on a scooter, and I looked perfectly fine, right? So you get all those looks.
Yeah.
Whereas if I had cancer and I had a bald head, right, I probably would have had a little more empathy around me. But it is tough.
Well, you could maybe shave that hair. It looks lovely, maybe you get more
And kind
sympathy.
of look like you.
That's look like me with hardly anything left anymore.
Boy,
So
it'd be some
then you get
saving
more.
time.
You might get more empathy by after you shaved it. Then no, you don't really need that. Then you look in the mirror yourself and say, "I look crappy. I look crappy."
My
No,
looks
but
could match my feelings.
that's it. I wanted to mention, for example, today is that the complexities of relationships. Somebody was working with their child. Their child's, keeps getting better and better. It's probably two-thirds better. And finally, she decided that, well, I think now that my child's two-thirds better, I'm going to get treated because she already knew that she was sacrificing for a kid for several months and didn't mention to the family that she was struggling. So now a month later, she's actually getting better faster than her daughter, but she just sacrificed her health to focus in on that daughter. So it's a the dynamics of the is you can't really understand the dynamics until you have that one-on-one relationship with people, and how do you get them inside? I just always remind people that as part of taking care of people is that sometimes the old-fashioned stuff does it's easy to just remind people that that's what some people with Lyme, in fact, most people with Lyme would like to have some communication where they're at and how to build out of that. And they usually have just a teeny flicker of hope if they're in rough shape. How do you work with that? How do you get persistence despite the setback, despite the Herxheimer's, so you can rebuild? And that's been quite useful.
Yeah. No, I could only imagine. But, they say that you do anything for your child. So that makes sense, right? Let's
Yeah.
treat my child first. But on the flip side, it's not, aren't you supposed to fill your cup first in order to be able to fill somebody else's?
Well, and
So
if
it's
you're an
got to be a tough
airline,
battle.
if you're an airline, you put the mask on first,
See?
but in Lyme they tend not to. They tend to they're the last ones on the list. Usually they said their kids is the canary in the mine, and if they get better, then all of a sudden they'll say, you know what, I think I better do something myself.
Yeah.
Time.
Yeah. So when you start a patient on, their particular antibiotic protocol, do you have a specific time frame as to when you want to see the needle start moving, right? Because many people will start a treatment and then, like you mentioned, social media earlier, right? On social media, oh no, now there's this protocol. And I know you work mostly with antibiotics, but people will want to bandwagon from this to that, kind of like a sports team, I guess, whoever's winning, whoever's in the Super Bowl. And is there a time frame that you think we need to stick to a specific protocol to see if we can get that needle to move?
Well, there are people that seem to get better within a month, in my practice, that they're already starting to forget to take the medicine because they're doing well. So they're like, even this mother is doing pretty well already. She's not where she wants to be yet. So it's just that if I take the toughest patients who've been really sick, overwhelmed, they often only get a window, or a couple windows the first month because there's so much going on with the immune system. So even though I try not to create Herxheimer's, they can still have plenty of crap going on in that first month. It's usually the second month that picks up speed and goes forward.
Okay.
I run into some kind of a problem because there's some of my colleagues think that you shouldn't have a Herxheimer at all, that therefore don't take any treatment for Lyme at all because you don't want a Herxheimer, therefore you have to go this other direction, alternative medicine or mold. And so, it's not that treatment for Lyme is as pretty as it sounds. It's just how do I figure out how to get that first month under control and find them emotionally and physically being able to at least get in the right direction. And it seems to help to not worry too much about the first month.
Okay, that makes sense. And yeah, I still love going back to the fact that you want to start slow and steady, right? Because you throw this at somebody who's already feeling like crap, and then you put him in a major tailspin in a herx. Like, what's going to make them want to stay? What's going to make them want to, have hope and keep fighting if they're like, I can't even handle, this treatment. And so I love that you kind of tailor fit to what their needs are and what their body can handle.
Right. So it's a lot of these good, these colleagues are well-meaning, is that if, they've heard that if you throw everything high dose all at once, two Bartonella things, three Bartonella things, everything at once, is they already know that if you do all of that at once with higher doses, that's overwhelming. So they're already realizing that if that's the protocol, let's try something else. What I'm introducing, what I've been doing for all these years is saying, well, that instead of the most you can do, the massive doses, why don't you meet them where they're at and start working with it that way, and not making such a Herxheimer type of reaction, the overwhelming reaction is that can they at least bring their patient back again? And, they can still do alternative medicines and things like that to help, but reintroducing a way to get the process started over again, or a lot of protocols, they don't include Babesia. Babesia is an important parasite in a tick, and they just do doxycycline,
Hmm.
or they do doxycycline zithromax. Maybe they'll add rifampin, but they forgot instead of focusing only on Bartonella, why not remember that Babesia is in these ticks? And that
Right.
requires a different treatment. So they'll come into my office without anything for Babesia. Some of them have sweat, some of them have air hunger that you see in Babesia, some don't. But they'll forget that, why don't we revisit that issue? And and so when you do, then that's where you're like, I look good in that situation. And thinking, that's it? That's all I missed was that pill?
Yeah. Yeah. And I see that a lot out within the community. People will treat and treat and treat, and they never address mold, or they never address parasites. And like you said, Babesia is a form of a parasite. So it's got to take a different approach to it. And
Yeah.
and they've never been introduced to that.
Well,
So
what I do, sorry to interrupt you, is that my patients, when they seem to be sensitive to mold or are sensitive to mold by testing or to yeast or something else, is that when they have a path, if some of my colleagues go to the mold first, and then alternative medicines and then Lyme last, because they think of the Herxheimer. But I'm saying is that if you could treat the Lyme a little better up front, that sensitivity to mold drops some, so they aren't as overwhelmed by mold. So I'm still addressing the sensitivity to mold, but instead of just trying to get rid of the world of mold and their world of mold, is that if I get the Lyme under better control, then mold is not the issue. And so that's just a different way. They're probably both paths work. I just use this path. The mold people tend to use that path and get something out of it. I would prefer to go back and revisit with tailored treatment to try to get the Lyme under better control first. But that just works for me. It's not going to work for everybody.
right. No, and that's such a really good point that you bring up, because we get asked that a lot, is do I treat Lyme first? Do I treat mold first? I'm in mold. And so what I'm gathering, that you're saying that if you continue to treat the Lyme, say they are living in mold, but we don't know. Maybe I think a lot of people can live in mold and not have any reaction to it whatsoever. I know I'm one of the very fortunate ones that never did deal with mold. I don't know if I ever lived in mold, but I never had mold symptoms, and I never needed to treat for mold. So what you're saying is, if we can break down the load of the Lyme, maybe the mold really isn't as affecting you as much as we thought it was, because sometimes people will flip up their world and move their house and sell their belongings and, do all of this to get out of the mold,
Right. I find that if there's a limited budget, so a lot of my patients are on a limited
which
budget.
there is, right? We all are most of
Yeah,
the time.
that I find that revisiting Lyme, since it's typically oral with a generic product, is more cost effective, for something a limited budget. I also find that the tests for Lyme tend to be covered, even if the lab isn't so good. But some of those the mold labs and some of the other labs, they add up pretty quickly. The supplements add up pretty quickly. The hyperbaric adds up, so that's a fairly expensive way to go and time consuming. A lot of energy is consumed, and so even though I'm glad there are professionals and colleagues who are carefully following patients that way, I'm just saying, hey, is that I'm a lonely voice out here. Is that why not revisit from a lower end, and with some counseling and catch people back to what we talked about earlier, is catch them where they're at. Where's the hope? What can we do with that? And when the hope keeps getting dashed, when you think you got hope, and then you get some disappointment and this and that. And how do you keep hope alive when you have every day at the beginning, that your hope is dashed. And how do you like rebuild when it's so, it's easy for me to say, but how do you work with what you got when it's getting beat up all the time?
Yeah, yeah, and that is, finances are a huge part of this, and I hear so many times that I can't afford to get well. I can't afford to treat. I can't, and it is. It's a lot. And so I appreciate that there are doctors like yourself out there that take that into consideration from a patient's point of view, right? Like we all want to get our life back, but can we afford to? That's a big question. You only got what you got, I guess.
Yeah. So I think that, that there's a lot of people get sticker shock when they realize that some paths are rather pricey. And especially now, if they don't get much out of it, then they're like, they wonder how far to go, how much money to spend, how far to go down that path. Um, and then of course, once you go down one path, it gets more and more elaborate, more and more expensive protocols, more uncertainty, and you can flow through everybody's finances, the entire family, and drain them all, and still like thinking, gosh, I can't even revisit an infection anymore because I've already like overextended in every other thing that's done out there.
Yeah. No, it's a tough navigation in all aspects of it, for sure. So, talking about antibiotics, how do you support a patient's gut health? Because isn't that really destroyed by these strong, constant antibiotics?
Well, I always start low because the most important thing is both the herx and the stomach. Since the autonomic nervous system affects the stomach, is that if I can figure out a low enough dose and it's methodical, that with probiotics can get me through that phase of what can I tolerate. And so I might have to do single therapy because the gut health is important. The biome is an important part of health, and how do you disrupt it in the least possible way when you start? I can always add more layers if I need to. Um, if I can have them go to a gastroenterologist if I need to, if things aren't so smooth. I use nystatin sometimes because that helps the gut flora sometimes. The I think when it comes to the gut health, it's often a reflection of illness rather than driving the illness. So instead of only focusing on the gut and the leaky gut and the gastroparesis, is that if I do Lyme, how do I respect the stomach and try to gingerly move forward with treatment for the stomach? I mean, what I do it through the probiotics sometimes.
Okay. Yeah, I would think that that would be kind of challenging because, the majority of our immune system comes from our gut. So if we've already allowed our body, the pathogens to take over our body, right? Something's got to be, there's got to be a breakdown in our body somewhere. And I'm going to assume it's probably always in the gut or starts from there. So if we're already in bad shape in our gut and then we're adding the antibiotics to it. So probiotics tend to seem to work along
Yeah.
with your low and slow approach.
And stay away from alcohol, processed sweets. I don't find that I stress gluten-free so much. I individualize it. If somebody finds that that's helpful, but if I just focus too much on the gluten, they forget about everything else.
Right?
Some
Yeah.
people benefit, but it's not like everybody benefits from gluten-free diet. Not everybody benefits from any protocol. And on internet, which I'm on, social media quite a bit, is that what happens is somebody says, you're never going to get better unless you take this. And then the next one says, well, you're never going to get better unless you do this. But by the way, I'm so sick. And you're thinking, well, how are they claiming you're ever going to get better? But I'm just as sick as ever. And so then pretty soon the list gets bigger and bigger as you move forward of things that you have to do. And people write down all the things that everybody suggests. And the list gets pretty big of things that somebody
It's too
said
much.
somewhere that that's what you got to do. And I'm never going to get better with that. So sometimes they'll be so busy that punch list of things that you could do they never get back to well, how about a basic garden variety, ordinary, generic antibiotic might work, but no, they're off on even there's antibiotic protocols that have been introduced based on test tube research, but they overlook that there's some basic treatments. So they'll go off to the you know, disulfiram or double dose dapsone and other things, which is good that you got professionals working on newer concepts, newer protocols, but they forget that there are plenty of people who benefit from more standard treatments that are covered that don't have near the side effects. We already know double dose dapsone and disulfiram are well-meaning based on test tube research and clinical experience, but they're tough to take. And I usually tell people at least get to the basic things first. Doxycycline, amoxicillin, Ceftin, Zithromax, Bioxin, treatment for Babesia, which is like the Malarone, and sometimes rifampin and Bactrim. But those are all basics. But to move on to the next level, I have to take some time and get people thinking, well, that's fine. Somebody got better with that, but how about all this that you're overlooking?
Yeah, social media can be great because I know back when I was sick, there really weren't all of these Lyme groups, right? Where you can go and get the support and information. But like you said, there's so many people are they wear these blinders or these rose-colored glasses, whatever you want to call them, and this is what worked for me, so this is the only way you can get better. If you don't do this, you're never going to get better, right? And we know that we're so individualized that it's not fair to 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 say that or to spread that. I do know, and most of my listeners that have been listening to me for any length of time know that because of my undiagnosis for 7 years, right, I got left out of the loop, left for dead, basically, in my eyes, from the traditional doctors because nobody believed me and nobody acknowledged that I had Lyme or anything even wrong with me. And so I was the one who switched over to holistic health. And that is what saved my life, right? That does not mean that I don't believe antibiotics can help you. I've always said, we're all different. Do what works for you. I believe that there are other great approaches that you can do if you have chronic Lyme disease prior to doing antibiotics. But my biggest thing has always been the gut health of what the antibiotics can do to your gut. But yeah, there are so many, and that's why I have this platform. It's not for people to say, this is what you need to do. This doctor said this, do this. No, it's to allow people to understand there are so many different ways to approach this disease, right? And here is what this doctor thinks, and here is what this person thinks, and this is what worked for them. And they can then make their own judgment in which route they want to go.
Well, one of the things that happens is that when somebody posts that you have to take this, you're never getting better with this, is that what they forget is that they've been through a kind of an orderly progression. So a lot of them have been treated for an infection. They've been working on their biome. They've been already modifying their diet, but they often focus in on what's the last thing they did rather than they actually did get some
The
treatment for
foundation,
their
how they
biome.
got there,
They
right?
got there, so they just keep saying the last one they picked, whereas usually there's several things they've done to get there. And
Yep.
they've modified the diet, they've given up on alcohol, they've kind of worked on their emotional health, and there's a lot of things but it's always when you look at it, you don't get the whole story, you'll just get what's the last thing you did.
No,
What's the
that's
very last thing? And you said that, and they make it look like that nothing else worked. I didn't get anything else. Is that was it? And whereas hardly anybody gets to that level with at least doing something.
right. No, well, it's just like, if you ask somebody, how much does it cost for you to print this form for me? They'll say, oh, 10 or $20. Well, in
Yeah,
our mind, we only hear 10, right? Like that's it. We only heard 10. And so yeah, it's what's in our mind. And I think that so many of us start building that foundation in our body back up, right? That
yeah,
helped allow the treatments to work. And they forget about that. They
yeah.
just
The
know that at one point in their journey, okay, hey, I decided to finally quit gluten and I felt so much better. So if you don't quit gluten, you'll never get well. Yeah, it makes perfect sense. It's how our bodies work, right? Human nature.
Yeah, but one of the things that the reason I've done so many TikToks, Instagrams, and YouTube is that there are so many people lost in the system who have heard that you're never gonna get better unless this one thing is done. They're just so many people discouraged, or they don't want to take something, and so they put it off, they delay it, um, they're not thinking they're getting anywhere. They've lost hope. They lost that perseverance, that relationship with the doctor, and so they're taking a fatalistic approach. And so that hope, that perseverance, some of the treatment clues of low rather than high, babesia rather than just Lyme, just lots of things that I see in my practice any given day that are like kind of like pearls, things that I see that
Hmm.
get some people where they need to be without necessarily the high in every last thing they can think of. But takes multiple touches where it touch people's lives before they finally realize, oh, that's me to do something. It all sounds
Yeah.
good from somebody else, but
Yeah.
it takes a while for people to sink in that it applies to them.
Yeah. Yeah. And it does. It really is heartbreaking to see, there's good and bad everywhere, right? But there's sadly many Lyme groups out there, specifically on Facebook that I'm talking about, that are very closed-minded, right? They don't want to share other opportunities if it's going to take money from someone, or you know what I mean? It's just heart-wrenching that we can't just have an open platform for people to share their ideas, right? And then not be bombarded by somebody who runs a group saying exactly what you're saying. Well, if you
Well,
don't do this, you're not going to get well, And I have two platforms. I have Lyme Conquerors Mentoring Lyme Warriors and Lyme and Beyond with Tanya, and both of them are open platforms, right? I want people to share, but I also want people to be open minded that there is more than one way to treat. You don't have to do this to get well. People, like, they get lost in the system. They don't know where to go. They don't know who to believe. They don't know what to turn to. And then you have these groups of people telling you what you said. You got to do this. You got to do that. You'll
one
never get
thing,
well.
one thing that happens is the algorithms,
Yeah.
social media tend to reward colorful language. Most dramatic, the biggest and boldest and baddest outcome that you can think of. And so they tend to rise to the top. And then when you're sick, you want to hear what's the worst. So you tend to gravitate toward those. Those are the ones that get talked about all the time. And of course, if you get well, who wants to write about Lyme anyway? So all the ones that they'll learn from the people that are sick. You want to teach them that they're like you're doing, teaching them what you've learned, but all of them that you never hear of are algorithm doesn't really pay attention. They're not writing, not doing anything. And so, all the work on social media is certainly helping get the word out. I'm just saying is that there's some of the wellness, the hope, and other kinds of things, the trying a few things differently can get overlooked around with all the drama. So, good outcomes are, one at a time, and they're out there all the time. You
Yeah.
hear that all the time in your program. This program is great because Tanya, you're always bringing out that how do you work with wellness? How do you get there?
Hmm. Yeah. No, it's true. And the algorithm, right? Like, I can barely figure out how to work my cell phone. As we discovered earlier before we started recording, Dr. Cameron, you're way ahead in this technology world than I am, for sure. And yeah, the algorithms are tough, but all we can do is continue to share our voice, our thoughts, let people know that there is so much hope out there, that they can get well. You don't have to be, one of these famous people that are dealing with Lyme in order to afford to treat it. We know it's a struggle for everybody, but there are ways around that. There are compassionate doctors like yourself that are going to meet you where you are, right? Meet you where you are, how you can function through your treatment financially, and to where you can still support your family, your children, and provide a household for them. So So, what do you, kind of one last thing, I think, well, actually, a couple. So, how do you believe that the testing is right now? We don't need to talk a lot about it, but what are the general guidelines? If most of these testings that are done through doctors like yourself are not the tests through IGenics or Armin or some of the other ones. Most of them are a lot through Quest, and a lot of them are negative. Do you do clinical diagnosis as well if the tests do come back negative?
Well, I mostly use clinical judgment to treat. You know,
Oh, okay.
it doesn't mean I don't order tests. Like even Quest has its problems, but if the budget doesn't call for much, at least that's covered. I
Right,
don't
right.
regularly send to Armin Lab, who I know well and does well, or out to Hygienics that does well, because it depends how much money people have.
Yeah, looks
Sometimes you can
expensive.
end up spending like 2 grand more, and just when they on a limited budget, and then if you decide to do it more than once, it adds up some more, and then if you add the PCR, it adds up more, and so since, seems like some of my patients are in a budget, if I listen to them and follow them, is how to, if I want to use clinical judgment anyway, including Babesia, I try to keep control over how much I do.
Yeah. No,
The
and
tests
and
are
that
not
makes
as
sense.
reliable anyway, even if you go to Hygienics or Armin, they're still having troubles with it isn't quite right. They're still having troubles with some, or they even get false positives, false negatives. And so that's why I spend more time on clinical judgment than I do on the elusive test.
Yeah, and that makes sense because, I understand people, especially those that have been battling for years and can't get answers. Sometimes people want that diagnosis, right? It's like it's a tangible thing or something, and I get
Yeah.
that.
And that
But
makes sense.
follow where
Depends
your
on the budget.
finances are.
Depends on
Follow
your
where your
budget.
finances are. Yeah.
Yeah.
Is it more important to get that diagnosis, or is it more important to start your treatment? So,
Well
yeah.
stated. Yep.
Yeah, that says it all. All right. And so then I know that you've talk a little bit, or I believe you have some new things on the horizon as far as treatments and stuff. Can you share anything that you're working on that is coming down the pipeline, or where things are in that?
Well, some of the things like isoniazid double dose dapsone and disulfiram are being worked on by some of my colleagues. I'm just more of working on common sense Lyme approaches that even though they're out there and are things to do in mold and alternative medicine is how do you find effective ways to get people re-entered in the system and taking on Lyme and walking through it. So it's more of a common sense Lyme, which is kind of on a centrist approach than what's the most I could do. And that's so all of these blogs and posts and podcasts that I do are to try to remind people of the fundamentals, the basics, the some of the tools instead of bragging rights, because I certainly have people that are just as sick as the sickest ones that are on the social media, but you know, and some of them do take the path of doing antibiotics the right way, alternative medicine the right way, mold the right way, and they're still sick too. So it's a challenge. Now, a lot of times, well, I'll leave in your comments section the social media links that I have for
Yes,
you.
in the
So I'll give
description we
them
will
to you
put
so you'll put them in there because
all your links. Yep.
I'm working on the fundamentals, and it may look like it's not so exciting, but be surprised how often your friends and families, your loved ones are out there who are get lost in the system, and those are the ones I'm capturing rather than those who are just at the cutting edge and they're so tough. How do you catch everybody else? You don't want anybody else to go through what you went through.
Right. No, and I think you're spot on when we need to catch the ones who are brand new. We don't know what we're doing, right? Do we have any
Newbies,
hope?
newbies.
And yes, the newbies. And then so many times in everything in life, we can overcomplicate things, right? Sometimes we just need to get back to the basics. So I love that that's what you're sharing on the social media. That's hopefully what going to draw these newbies in, give them hope, and not let them go down the rabbit hole for decades like many of us do.
Well said.
All right, Dr. Cameron, this has been amazing. A total honor to meet you. You kind of have a soft place in my heart now. I appreciate how you approach these patients from all different aspects of, just meeting them in the middle, meeting them where they are. We need that compassion. We need that empathy within this field, especially, and we don't get it a lot. So I appreciate you. And again, for the listeners, we're going to put all the links, all the ways that you can follow Dr. Cameron on social media, as well as his website if you want to reach out to him. So thank you again so much for your time. I really appreciate you. I sure hope you listeners enjoyed that episode. Whether it's hope you needed, a little inspiration today, or just maybe some validation that what you're feeling, what you're going through is real. Maybe you needed tips on how to treat at home, ideas, thoughts, detoxing, whatever it is. I truly just hope it's what you got out of today's episode. That is my only hope, is just to give back to this community in any way possible. So go to the about of this podcast, scroll down to the bottom and find that donation link. Go ahead and click on there, and anything that you'd like to donate or offer is all just going to go to help to pay towards the studio cost.